I'm Mark Davis, and we're Second Nature, experts in sustainable digital lifestyle change. And we're on a mission to use the science of habit change to make healthy living second nature. To date, we've helped over 40,000 individuals change their lives. So let's first address the problems you're facing. Your customers are expecting Amazon levels of personalization. Retention is a real challenge because it's hard to maintain your user engagement. Obesity is a large cost burden for you, but strategies to tackle it struggle with return on investment. And lastly, challenges are innovating and shaking up the space, so it's really difficult to keep up. So to address these challenges, we provide sustained engagement for your customers to build your customer retention, proven health outcomes that impact claims, and the ability to enrich your understanding of your users with valuable health data. But before we jump into the value we provide, let's first have a look at the core components of our product. You can summarize Second Nature into 3 distinct elements to achieve sustained behavior change: track, support, and learn. So let's first look at track. Users are able to track their weight, step, sleep, and habits in real time, utilizing our connected tracking technology. They're able to track their progress on a daily basis, which provides a really strong positive reinforcement cycle that motivates them to stick to the habits they've made. The personalization and sustainability of our program is made possible with the one-to-one support that every user receives from a qualified health coach. Our coaching model is unique, providing continuous support without the need for an appointment. Our health coaches transform our users' physical, mental, and social well-being every single day. The Learn element of our program provides the educational backbone to our product. Users have access to daily educational articles, a huge recipe library, exercise videos for all abilities, and other features to become well-being experts themselves. I mentioned 3 core components, but there's a secret addition called Sustain. This is where completers graduate to after the 12 weeks. It's entirely focused on embedding the changes an individual has made, providing additional content that is further supported by health coaches. Users never lose access to Sustain because we don't ever want a user to slide back into their old habits. So how is our program valuable to you? Firstly, our ability to engage with users is market leading. 43% of our users are still using our service at 3 years, significantly higher than our competitors. If we partnered with you, we could translate our sustained engagement into increased customer retention for your organization. Secondly, we have market-leading long-term weight loss outcomes. Users really see results really quickly, typically within a fortnight, and maintain them for at least 2 years. Sustained weight reduction leads to significant claims reduction for a wide range of costly ailments, including diabetes and cancer. Lastly, the data we are capable of providing can enrich your understanding of your users. The rich data we're gathering on a continual basis can improve your ability to market your insurance products, underwrite more accurately, and build better insights into the claims behavior of your users by using our data. We come to the table with experience working with insurers. We're a health partner with Vitality, providing our service to enable their users to engage in their health for the long term and boost retention. So to close, it goes without saying that we'd love to partner. We'd suggest that a pilot cohort of 250 users willing to improve their health. By the end of the 6 months, we'll have a good idea how our program has impacted your customer retention. By 12 months, we'll have a great idea. Thank you, and hopefully we'll hear from you soon.
Wonderful. Thank you, Mark. And can I have you come up to the stage?
Hi, Ava. How are you doing?
I'm good. How are you?
I'm very well, thank you. Very well.
Great. Does the audience have any questions? Feel free to drop it in the Q&A, or you can drop it in the chat, or you can simply raise your hand. Does anyone have any questions?
Yeah,
Looks like we had one come in.
Yeah, sorry. Do you want to do the intro on the question, or shall I?
Sure. Yeah. So the question says, what diet do you focus on, since diet causes many diseases and even better can reverse heart disease, diabetes, etc.?
Absolutely, yeah. So I guess as a broad generalization, we cover a lower carbohydrate diet. The rationale for that is that we are effectively trying to reach a calorie deficit, but a lower carbohydrate diet has been found in our own experience and in the evidence that we are particularly aligned with, that it's the easiest engage with and stick to over an extremely long period of time. We found that calorie counting is typically unsustainable over a long period of time, and in many cases is actually a negative habit for people to get into. Effectively, we want people to have a much better relationship with their food. So we found that a lower carbohydrate diet, that's not low. We're not asking people to, completely cut out, loaves of bread or a croissant or whatever they want to have. It's just mediating that so that, you can effectively reduce your blood sugars, and help lose weight sustainably over the long term. Thanks. Thanks, Chuck.
Wonderful. And it looks like there's one more question. Have you offered the Second Nature solution in different geographies?
Yeah, so we are predominantly UK based. However, we have on Monday, very excitingly, just launched in the US. So yeah, I guess COVID has just radically accelerated our timelines in terms of uptake and reach across other geographies. Just for our kind of a location, Western Europe, we're covered across, and Australia and New Zealand. So yeah, quite a few geographies, most notably US on Monday. So it's an exciting space for us now.
Wonderful. Thanks, Mark. I think that's all the time we have for questions today.
Thanks, Ava.
Thanks for joining us.
You're welcome.